supine or in prone, usually kasi segmental motion. Okay? So if there's a need, if patients are able to move, we just instruct them. Sige, please put your hands across your chest. That is to secure. If mag-move ko siya, di ba wala ka sa gabal ang iyang arms and hands. Sige, we'll start with the shoulders first. Sige, di ba? Position the patient close to us as much as possible. So we're going to move the patient near us. So here, shoulders first, and then hips, and then the lower extremity. As simple as that. And if you're done, so again, we're going to push the patient back. Okay, so pwede lang this one. Kung kaya mo man lang, so pwede lang hindi na left like what you're doing. If not, then you would need to insert under and ang patient. Clear? Oh, very simple, side to side lang. Okay? Sige, next. Moving the patient up in bed. Ayan. Sige, I'll demo first. And then you will see. Sige, this is for text purposes lang, for quiz and written. So, damo lang ka slides because yung breakdown lang if it's dependent and then you're independent or assisted. But for them, it's all dependent. Ha? Sige. I'll start with moving up the bed. Oh, so example, target them. Ang keys mo is, upon entering the patient's room, okay, so the patient is at the lower part of the bed. So let's say kabunggo na yung tiil sa edge of the bed or foot of the bed. So our tendency is dapat sa kao na si patient. Sige, we'll start with your independent or your assistant. Okay. Kung meaning na-identify ta, si patient can move or at least strong enough siya to hold. Okay, to hold on to. If you could please bend your knees, both your knees. Ikaya niya man, di ba? Okay, if you could position this one, and your arms, with your elbows on the bed. Okay, sige, on the count of 3, I will need you to push down on your elbows, and then push down on your feet to move yourself up the bed. Hindi kayo mabangon up the bed. Sige, if you're going to assist, we're going to assist here sa hip. Okay, sige, count of 3, push down, pull down. There. Simple as that. That's your assistant. Kung independent, isa lang niya isay, no guarding at all. Questions? None. Very simple. Okay. Sige, for the dependent, here, always ask kanay ha? Sige, I'm going to cross your arms on the chest. So, hindi always talk to your patient. Hindi pwede mag-get them. Mamo ka lang na yan. Di ba? Again, obtain consent. Okay? So, as the patient is unable to move on her own, di ba? That's why we're going to do it by ourselves. Sige. I'm going to cross your arms across your chest. Sige. This one, nanay. So, ano first? I-move ko na siya na yun? Ano, nanay?
Consent.
I-bend ko ang knees. Yeah, we're going to bend your knees. I-move ko na siya na yun. Ay, i-move ko na siya. Ano dapat? Yes? Ay, pwede ko na siya i-move. Oo. Or pwede ko na siya i-move off the bed. Yes? One, yan, nine. Or si patient sa center. If you're going to squat, you would need to reach. Di ba? Segmental rolling, yan eh. Move the patient close to you as possible. Perhaps, you don't need to reach. Okay? There. I think that's better. Kung hindi budlay sa akin. Okay? Again, points of contact are shoulders and hips. This time, since sa pelvic girdle, so dapat ililita. Okay, just under the buttocks na yun. Sorry. Yung hair, diba? Hindi sakit. Sorry. Alright. So, sorry, see it back there for Dina. But, I'm widening my base of support, feet parallel, and then I'm squatting. Okay? Alright. And then, back straight lang. Sige. At the count of 3, I'm moving up the leg. So, iban, pwede sila ka-rock or ka-willow. Okay? What if you think kaya mo, there's no need for you to rock. Okay? Give instructions na. Sige. At the count of 3, I'm moving up the leg. 0, 1, 2, 3. There. Again, wala tayo super lift ha. If you could just slide the patient slowly with a little lift, then rotation. Okay? And move the patient back sa center of the bed. And then put them sa side. And then di na nga itong mga support. That's the head. Where else? Under the knees, assuming, we'll put it here. Where else? Sa low back. Low back na. Hindi mo natin punta sa low back ha. Kasi we're going to put it, lordosis, increase lordosis. Where else?
Elbow, arm.
Sa?
Arm.
Sa feet, you have a demand. Here, under the heel, in half. Yes, here, diba? So you could put here and another one here. Protect the bony prominences. Mag-rate them. If wala, hindi kami na-provide my pillows, you can just tell us, Sir Richard, Miss Jess, assuming there's pillows here, pillows here, pillows here, pillows here. We'll just consider. At least you tell us where to support. Clear? Questions with moving up the bed? None? Okay, we'll proceed with moving down.
Nasa traps lang ito. Wala do massage mo. Good.
Pag sulod mo, nagsaka na si patient, siya pinakiliwit na siya, head of the bed. Diba, may board to be sa head of the bed. So, ideally, we're going to move that patient down. Okay, we'll start still the same na technically nga procedures. If the patient is able to do so, dapat na pwede na siya nag-wriggle-wriggle, siya padalo. Or just in case, for assisted time. That's your assistant time. And then, and the observation, pwede nag-kibig na si patient. Clear? Sige, for the dependent, okay lang mo. Basta naglapaw na siya, di ba? Remember with positioning, as much as possible, di ba? Wala may gadambol or galapaw sa mga bed. Cross your arms, cross your arms. Dependent. Sige, still the same. Points of contact, so under the hips or here, sa ibang area, and sa shoulder. Assuming lang. There. Sige, still the same here. So proper body mechanics for you. Okay, so squat, feet are parallel, base of support. There. Here. And position the patient at the center. And then you provide all your support. Clear? Sige. Technically, if we're going to let the patient here stay for this position, okay, what motion is this getting? Sa akon. Plantar flexion. Technically, this is the most comfortable. But, this is not ideal, especially if you want the patient to sit and stand later on. Okay? This one also. Tendency, if the lower extremity is weak or unable to move, ma-plantar flex and ma-externally rotate siya. Okay? We do not want that. Because later on, magtindog si patient, nakaamo na siya. Nakapo mag-post lang siya. Mabali lang siya. Hindi pwede, di ba? Tapos pag-walk siya karoon, nangga muna siya. Di ba? So dapat, naka-flat, proper anatomical position. The patellas are looking straight siya yan. So dapat, naka-neutral knee, and we usually provide something here. Parang naka-dorsiflex. It could be a pillow, kung we are at the foot of the bed, basta dapat naka-amoni. Okay? If there is a need, for example, rolled towels, or rolled yung mga sheets if you want, you could insert that here sa diri. Or, if you have small cushions, assuming small lang na sila, pwede nyo mabutang diri sa side to prevent the lower extremity from externally rotating. If patients are like paralyzed or very, very weak, katama ang muscles, pillows or roll towels won't do. Kasi madala sila gyapon with regards to gravity. So you might be able to see, may ginabutang, hindi yung mga sandbags. Para hindi bala madala sa tikil na mag-rotate siya outside. Clear? Sige, question so far. Moving up, moving down, moving side to side. None? Sige, we're done with that. Here. What if wala ko equipment? Need gidya nga? Wala ko nang i-feel. Diba? What if hindi ko kaya on my own? Or let's say kaya ko, but kasakit ako ng bulsubo. I would need to utilize help from somebody. Okay? So if you're familiar, usually we have flat sheets. Sino na na-try nga na-admit sa hospitals. But if wala man yung mga flat sheets, we can try to put them. Sige. I'll show you how to properly. Sige, fold your flat sheet in half and try to tuck it sa kilid niya. Magambal tatak, meaning isulod siya. Insert, insert. Do not hold the patient close to you lang yan. Okay, but I would need to roll you on your left side. Again, point of contact, shoulder and hip. And use your body to support si patient. That's why nagtakot na siya para masulod na siya. Okay? And roll to your left. So, ayan na ato niya. Sheet. Sige. Inhale. And another. You're okay. Ito na. So here,
Go, let's go, girl.
sige here. So hindi pwede nga magaway kami. Nga lapit siya sa ako. Si a patient is near me or near her. So di ba? Center of gravity close as possible. So what do we usually do? We're going to roll the sheet near the patient. So tira kami mahulog. Since this is more than one person ng bed mobility, so one has to give a command. So assuming ako ba give a command, ha? Sige. Any na siya sa please well. If you notice, ako nakaamo ko niya, forearms pronated. Sorry, I cannot remember all of it. See? Linzel is naka-hands is supinated. Whichever you're comfortable and you think you're stronger. Ha? Wala yung preference ka, dapat naka-amo or not. Okay? Sige, at the count of 3, we're going to let our bones like a bit of the bed. Count of 3 pa. Sige. 1, 2, 3. There. Same with, example, sige, moving down the bed. So the count of 3 will move the patient. Then towards the bed. 1, 2, 3. Okay, on that one. Sige, so hindi pwede hanga. Sige, so hindi lang. Hindi po si patient out the bed. Okay? Ready? O, di ba? Wala akong nag-command niya. Nagdali-dali na lang yung sa laser. Or what if natuna pa muna nag-iway na itong lawas na patient. Clear? That's why you need to have proper communication with your partner or your colleague. Clear? Sige, with regards to removing, lang. As easy as that. And back. Clear? Sige, ang wala magutang, tahaan mag-moves lang.
Parlala.
Sige, again, sometimes patients could use the trapeze bar. They're able to do so to move up and down the bed. Mayroon man iba nga, they could use the head of the bed, but very good line. Kasi ma-reach sila, nabutong yun. Okay? Hindi siya advisable if you have shoulder injury, if patients have shoulder injuries, or they have poor grip. Kasi wala sila yung pag-grip. Sige, question so far? None. We're done with that one downward. Up down. Nasa dependent, independent. Sige, no questions. We'll proceed. Yes. Next, we have your supine to sideline, supine to prone, prone to supine. Sige. For supine to sideline, there's no need for us to move the patient near us. If lapit sila sa aton, and we move them to sideline, or nagit sila yung sa super edge on one side of the bed. So patient is just at the center. Sige, take note. For this one, especially for random purposes, dependent. So the nearer upper extremity is abducted to 90. Okay? Flex at the shoulder. And this one. Paano na siya. The farther upper extremity is crossed across the chest. For some, you might be able to see the farther lower X is bent at the knee. Or pwede man, kasi what if medyo weak, so ang tendency, maamo na siya. Okay? So, mas better, we usually, the farther lower extremity is crossed over at the ankle. Okay? Not the other way around. Nga pang move mo na. Okay, pag move mo na towards the side, masakit siya. Okay? So, farther crossed over the ankle. So again, points of contact, shoulder, and the hip area. Okay? Again, we never, okay, we always roll the patient towards us, not away from us. Wala tayong naula si patient. Gusto malang-alang, amon mo na, hindi pwede. Always towards us because we could use our body to catch the patient. Just in case, ato yung mention na unusual events will occur. Clear? Sige. So again, points of contact, hip and shoulder. Sige. Towards your left. 1, 2, 3. There. Simple as that. So dili wala may naipit. Okay, sorry. For demo purposes, have to be clear, pero makita nyo lang kung anong itsura niya. Pero makita nyo lang. So ang buwa is, tinagaw mo na siya. Pag-roll, pull it towards me. Wala may naipit or anything. Clear? And then, ano ba yung mga supporta, if ever? Pillows here, under the head, din ba? Between the knees. But, ano ba yung hambal ni Sir G? Ang upper leg is? Flex. So meaning, here, provide na. There. And then, diin pagin ni pillow. Where pagin sa head. Where between. Where? Between na. So, yung nakaamo na lang madam or nakapos. Diin pagin. Sa head. Assuming meron na sa head. Diin pa. Sa? Yes, here sa back. For just in case, kumbaga muna siya karon, maliso si patient. So, put something here sa back to maintain this position. Again, this is for demo purposes and for you to see. But technically, we roll the patient towards us. Clear? It's okay. Questions with your supine to sideline? None? Clear? Sige, we'll proceed with your supine to prone. So again, towards us. So in this case, I would need to move the patient on one side of the bed or the pin. Okay, so hindi ka magtagtuto. So if there's a need, sige, mag-move na po my patient towards the other edge. For hospital beds, usually they have rails, so you can pull them up. So since our pins wala yan, so make sure na ang patient is safe, hindi siya matagdag. Okay? Sige. For supine to prone, the nearer upper extremity should be tucked under the hip. Sige, para kita ka mo, when we say tuck is, nakaipit siya ang lahat. Sa dalong sa hip. Okay? Usually, palm up ka ha. Wala naka ang na. So, palm up lang. That's the nearer upper extremity. And the farther upper extremity is just clipped at the side. Naka-clip lang. And farther lower extremity is crossed over at the ankle. Okay? So this one, supine to prone, patient could just look up or pwede naka-look away siya. So again, points of contact, hip and shoulder, but this time, we're going to include the hand sa hip back. Okay? Sige, the count of three, overview towards your left side lang. Okay, 1, 2, 3. Sige, if you can, release kung naikit doon tayo, that's why ginatak pa siya. If galing yung ulo ni patient, have them rest in this position. If not, then you can continue on with your on that one. Naka-prone na siya. On that one. See, are you comfortable with your hands to the side? Comfortable si patient. Do not always assume mga mumuhay na lang si patient. Wala na yung pinitay na dapat ang movie na. Okay, if meron ba si patient hindi siya comfortable with hands to the side, then you should do this position. Clear? Sige, and then we provide our support. Where are our support for pillows? Sa head, where else? Stomach, small pillow lang yung hanap tungkay. Kaya mas imaamo naman na siya. Itong pillow, in the abdomen. Okay, here. And a little here sa patella, sa knees. These are our pressure prone areas. Clear? Question with supine to prone. None? Sure, mabilis siya po. Sige, next. You're prone to supine. So, let's say in case you mag-read them, upon entering the room, patient is in prone, but you need to examine the abdominal area. So, best position is supine. Examine that your part of the body. So, same lang. Move the patient to one side. Sige, the nearer nga upper extremity tucked under the hip. Okay? And then this one, still clipped onto the side. And the farther extremity cross on the legs. Over, ha? Hindi pwede the other way around. Kaya matwist na yung ankle. Sige, ang heady naman yan. Hindi na sa supine habang ito pwede. Nga straight up lang sa side. Towards me or away from me? Away from me? Sure? Namangkot lang po, sure. Change na dapat. Oh, wait, hindi pwede yung looking towards me. Bakit mag-isog na napatay si patient. Away from me dapat. Sige, ma-look away siya dapat. Okay? Still the same. Shoulder and hip. For this time, clip lang. Okay, yung iyang hand. Sige, the count of three will move you towards your right. 1, 2, 3. There. Firma release. And up towards your back. There. Questions? With your prone to supine. Clear?
Yes.
O, sige, huhula ko pagkadali ka mo mga dumata mga support sa bag ko.
What if previous ang side lang sa intern mo sa iyo na mostly patient sakit?
So meaning, hindi tayo mag-turn on that side. Sige, if there are cases in which it's painful, especially mag-weak bearing on that side, so we will never turn on that side. Pero if like mo to hindi mo prone to supine, so as much as possible, medyo dasig lang ka. And have somebody assist you. Or ma-assist niya ito ang painful side. Both painful side. Usually, kung both painful, wala ka na lang siya pinapahaba, kasi magagayan siya to move. So usually supine, and then we just change the position, let's say Fowlers, semi-Fowlers, if may difficulty in breathing. If there's a need, here, quick question. So, wala ta siya ginapa-prone, pero need ta i-examine iya nga upper back. What would be the best position if the patient cannot assume prone position?
Sitting.
Your? O side lying. Hindi mo pwede side lying. Kasi naman nila sa sakit ang sides niya, sakit niya shoulder.
Sitting.
Your? Sitting. Ikaw sitting, may support sa back. Hindi naman makita yung likod. Semi-Fowler. So, mag-earphone. May support
Ano to gani?
siya with the bed.
Ang may ulunlan to ba?
Same. So, hindi siya hindi pwede kahapa. di ba?
Ang may ulunlan to sa may ulo ba?
There's one position.
Nagapangko sa?
Oh, yes. You're orthoptic. Nakakapungko siya, pero nakaamo na. That could give us access to the back area. Here. Sige. No questions? Here. Sige, again, these are for the text step by step. Sige. These are our pediatric plinths. So they are more wider than the usual plinth. So there's no need for us to move the patient towards us. What we usually do is, kita na palapit. So, if you can notice, sila yung nagsaka sa plinth palapit kay patient. Here. Sige, next. You are supine to sitting and sitting to supine. This is one of the bed mobility transfers that we very common na ginado, especially if after a long period of time, nabihigda si patient, we're now ready for the patient to sit. And then the exercise na sitting dangling ng hanan. Hindi ko siya ready to stand. Okay? So if you're going to utilize the proper technique, regardless of weight and height, kaya nyo na yan. Clear? Sige. So here, for supine to sitting. Sige. Put your arms around the chest. So here, take note lang. Supine to sitting, under the shoulders, over or across the knees. Ang mga atong points of contact. See here, under the shoulders, usually my forearm supports the neck. And then, across or over. Okay? Medyo budlay lang if you're a little cute and height, laba-laba si patient mo. Kasi ayawan ka or reach. Okay? So, mas scoop the here. Sige, count to feel position 2. Sige, so 1, 2, 3. Support. Okay, are we done with the transfer? Yes?
Oh.
Yes? No? Okay, nanisi.
Tanaw yun.
O, diba? Do siret. Ano dapat?
Ang arms and legs, make sure na comfortable.
What do you mean may fix? Paano i-fix ang arms and legs? Extend.
Arms.
Extend the arms. Elbows. Extend the elbows. Ano? Okay na na? Okay na ni? No, yeah. Wala na what's wrong with this one. Yung dangle. Yes, ang goal na diba? Sitting dangling exercise. That's to develop trunk control for sitting and preparation for standing. So, okay na ni? Duka sakto or duka wrong?
Pa-center mo naman.
Ah? Yes, ipa-center. Ito siya ang kiwiyo. Ang isa niya ka-tip is near the edge of the bed. Okay, so if there's a need for you to support, let's say, diba, kanina ang right, kanina ang weak, sige, hold on to your right hand. Sige, and then I will sit this one. Sige, can you move your left back towards the bed? Sige. Nan, support this one. Sige, right and left. Okay. Alright, better. Again, always position the patient back to the center of the bed. And then that's the time na pwede ka naka-tripod position on this one. Given that say half of the body is weak, iba kanina nag-assist ko din. So, paamamo niya na. And then this one, hindi siya rin makatukod. Okay? Always stand on the weak side. Okay, para kung ma-lose balance, are you to support. Okay? Or, example, for a long period of time, patient could get tired. Usually, arat na sa likod. But still on the weak side. Para kung makaupo si patient, kung ma-fall back siya, aritali to support. Clear? Sige, questions with supine to sitting? None? Sige, we'll put the patient back. O nakapoy na si patient, so gusto na siya maghigda. Sige. So here, sige, you need to secure your right arm. Maganda na secure, so si right arm is weak. So, hawiran lang ni good arm, ang weak. Okay? This time, under the shoulders, under the knees. Di ba kanina sa supine to sitting, under and across. This time, under and under. Clear? Sige. So, under. Sige, natin feel. There. And position the patient. Alright, naman siya sa center. Clear? Easy lang on that one. Sige, I'll just show you for demo purpose if nagsulit ka. Sige, kung under and under, pwede man. If, especially kung labak si patient. Kapag yung position to sit in a 1, 2, 3. Kasi remember, nag-twist ko yung akong back. So ako na yan ang masakitan on this one. Also, if from sitting to supine, example, under and across. So under, per nag-across ko di. Nagsulit ka ba? Sige, position you to lying down on your back. 1, 2, 3. Unless you have other motives, sir, ma'am. Wala, inanayag ko. But technically, tanawa, di ba? My shoulder is rotated or twisted or internally rotated akong shoulder. Even my elbow and my forearm. So, sakit siya. That's why, di ba? It's under, para hapos. Any questions? Supine to sitting to supine. None? Again, that's just a breakdown of it. Sige. For the independent, this is one that we teach the patient. Supine to sitting. So, instructions na lang. Sige. If you can move towards your left side. Meaning, makahiwo niya. Independent siya. Sige. Put it like down on your left side. Face you. Okay. Stay here. I would need you to push down on this elbow. And then, push down with your hand. Then, immediately down on your legs here. Sige, push your foot up. Hasta makapunta. Technically, this is the proper way to get out of bed. Magbangon. Sa lahat na magugtaw ka, kamo ka na din. Technically, this is considered trunk flexion. Even if from supine ka nga nag-sit ka. So again, the best way is, kilid una, push yourself towards sitting. Clear? This is one way or one of our patient education, especially for those who experience low back pain. Proper way to rise or to get out of the bed. Clear? Sige, this one, ang log rolling, usually for patients who have low back pain, would like sila mag-move, or if you've seen sports injuries or motor vehicular accidents, you're not sure sa current status ni patient. So, di ba very common, we never usually touch, especially sa neck area, for risk of spinal cord injury. So, wala tayong ginamove si patient segmentally. So, if there's a need, 2 or 3 persons, and we do your log rolling, meaning we roll the patient as one unit. Hindi ito yung kagina ang segmental. So, dapat may leader, at the count of 3, he rolls si patient. Or same, di ba, sa mga accidents, kung ibutang ka na sa stretcher, so dungan, synchronize, at the count of 3, move na si patient. Clear? Sige. I'll show you here this one. Oh, si Jay, you come here and si Louis. See? Oh, we're having here. Wait, come na siya patient. Lagi lang patient. Sorry. Okay, sige. For a 3-person carry, very common example, we nakabot from the ambulance. So we transfer na from stretcher to the hospital bed. Okay? Sige, there's always supposed to be a leader. So, how do you choose who will be the leader of the 3-person carry? Assuming nga unahan ka na kamo. Kasi mambaga mo, ikaw Miss Jessica, ikaw mas tigulang, ikaw mas experience, ikaw licensed ka PT. Sige, assuming, if we're all working in the hospital, we're all licensed. We're all professionals. We all are knowledgeable, and we have good communication skills. So between Samon, ni L'Oreal, ni CJ, sino dapat ang leader? Usually, ang leader siya nandun sa head area. Sino? Ako tayo na how? Kung hindi pwede, yung L'Oreal, okay, gwapa siya yan. Manakiyabang na nolo, siya yan. Oh. Or hindi pwede, si CJ, kasi technically by gender, siya yung male. Technically, ang bago na male. Oh, hindi pwede ako na. Or, for example, kanina po ko sa school, sa aga, kapoy-kapoy, napagdiri ko yun sa legs. So, how do we usually choose? The strongest, sige, we usually have 3 criteria. The strongest, ano pa? The tallest, and ano pang medyo physical attributes na go hand in hand with the tallest and the strongest.
Muscular.
When you say weight, meaning?
Ang mass ng
Body mass, or usually the biggest. O, tisa mo na tatlo. Sino? Ako yun. Okay. But then technically, if we're all the same height, so eliminate na. So check na lang who would be the strongest or the biggest. Pero take note man also. Sige, I'm not trying to body shame or judging or everybody. Example B, doon ka, dako-dako lang yung kuya. Okay? Pero, example, do teddy bear kuya. No, hindi ko kaya. Dako-dako lang ko. Okay? So you check also. Does it mean ako pinakadako? Ako pinakataas? Pero I'm not strong. Ako din automatic. Clear? Sige. So here for the 3-person carry, sige, point of contact for the one who is going to lead ang sa head is under the shoulders still, the forearm will usually support the neck. And then sa scapular area, that's under. The one in the middle usually doesn't matter na lang kung sino si second and third. The one in the middle, just above, okay, sa pelvic girdle, and just below the gluteal fold, sa buttocks area. And then the one sa lower X, okay, sa knee, popliteal area, at sa may ankle na yan. Here, sige, the count of 3, we'll try to secure and the count of 3, we'll insert. Widen wings of support, proper breathing neck. Kasi, check out mo. Hindi mo nga elbows. That one. Sige, the count of 3, we're going to slide the patient towards us. Slide na nga nakasapay. There. Sige, the count. Hindi ka muna. Maintain. Sige, count of 3, we'll flip the patient towards us. Meaning ka to bounce us after. Lift lang tayo using our forearms and hands. Okay? Sige, 1, 2, 3. The count of 3, we're going to lift the patient. We're going to stand. Say 1, 2, 3. On the count of 3, small steps towards the right. Now small steps towards the left. Assuming na makakita enough space. Okay, the count of 3, lower the patient down. Count of 3. Okay, any questions with the 3-person carry? None? So clear to siya ha? The transfer coming from point A to point B. Pinubusan niyo. Sige, next. hindi sumusuport. Sige, so we usually place our hospital beds, but they're hollow sa dalong. Okay, technically. Sige, first things first, for safety, so we're going to apply our seatbelt. Kasi assuming snug-fit siya, ha? This is the max. Assuming na this is not fit. Okay. Sige, again, you always transfer towards the good side or strong side. So in this case, kanina din identified, di ba, right side, the patient ang weak. So meaning, the left side is always near. Kundi intay ma-transfer. Here, sige. But on this case, so our transfer here is, hindi siya yung side. So correct me, Ediri. So what do we usually need to do? Ang weak ni patient is right half. Ma-transfer ta from chair to chair. For example, this is the toilet. Support the weak side. Sige, assuming ha, mangihi or mapoop si patient. So I'm going to support the weak side. So this is your sitting pivot. So sitting pivot, patient doesn't need to stand. Okay? Again, the left side is strong. Secure this one. Okay. If you could scoot over, first is near siya. Sige, scoot over your left butt cheek. Right butt cheek. That. Right. Sige, scoot until ayaw siya medyo sa edge of the seat. Not to the point na dumadagdag. Hindi siya yan. Sige. You said we're going to support this one. Okay? Usually, mag-support ka, ganito-nita, okay? Para ma-secure si patella. Okay? Or, we could clip on this one. Hold on here. Sige, hanggang nyo din lang ha, support na. Sige, I'll swing it towards. Tunza, pwede ko ma-hold. Just to be sure. 1, 2, 3. Okay lang to siya. And that one. Ngayon, hindi pwede. O na-transfer naman siya, mapupo, na siya mamihi. Sakit sa patient ang transfer. What makes you say na sakit kay patient?
Kaya since, ano ko na yung kaya
Weak? Right.
Right. Na pa-right siya, guys. So, bali, ang first impact sa right yung mas area.
Yes, diba? Remember, we always transfer on the good side. So, if this is a wheelchair, supposedly, we will need to transfer. Or even chair ba siya? Sige, sit down here. Oh, if this is the chair, the wheelchair, you would need to transfer on this one. So always on the good side siya. If there are handrails or may grab bars there, di ba? Patient could help you pa na makapute na siya. And then, masaylo kami. Okay? So for example, here lang. Okay, you can just scoot over. Assuming lang ang may arada. So, pwede na siya ka-hold on to help you. You just need to support this. Sige, count of 3 will transfer onto the, let's say, commode. Sige, 1, 2, 3. Pwede pa siya ka-hawid on that one. Always transfer on the good side at all times. Here. Sige. That is your sitting pivot. Remember, wala siya nag-stand. In terms talaga si patient. Sige, next, your standing. Okay. Sige, na-identify ka na again, the right side is weak. So, the left side should be nearer the where we will be able to transfer. Sige. Okay. Sige. Okay. If patient is able to, let's say, hindi mo siya paralyzed or hold on, di ba the most common, we assist the patient na hold on. Remember guys, always on the shoulder, never on the neck. Here, sige, anong tendency? This is to protect ourselves here. Because what if, sorry, bugat-bugat si patient. Okay? Kung hindi mo siya madala, ikaw tutungon niya. Pwede ikaw magka-whiplash injury sa cervical area. So, always on the shoulder lang niya ha. Okay? Or, if pwede, o secure na lang dapat wala na dito ya. Or clear to wala dito ang lugar na higit. Okay? So here, again, you could lock knees with the patient so that pag stand niya, may area na siya tukuran for knee extension. Remember, we do not push our knee against the knee of the patient. Something na yet to support. Okay? Or others, dili. You provide on both medial and lateral. Sige, if the plate is, can you stand that? Sige, if it's a little high for the patient, so we would need to use your footstool. If you're going to utilize a footstool, so the good leg, if you could put here in the footstool, there. And I would need to support this one. Sige. I don't want to feel you need to stand. Okay, mas stand ka ha? Standing 5 up. Sige. 1, 2, 3, stand. There. The support na ko gyapon. And, at the count of 3, I need you to pivot on your left foot and then we'll sit on the right. Sige, 1, 2, 3. There. Sige, am I done with the transfer?
Make sure na
Sorry mo ko sa weak side.
yes.
Oh, sa center of the bed still. Sige, you can squat now. Okay na?
Tripod position.
Extend up to support. Okay na?
Yes.
Oh, belt. You remove the belt. Clear? Sige, questions with your standing pivot from chair to bed. Or wheelchair to bed. None? Sige, we'll do the other way around. Here. So again, right is weak. So if my wheelchair chair again, transfer onto the good side. So direct naman tayo good side. And then move forward. There. So if malabot yung bed, kung may suot yung hindi niya yung malabot, okay? So we need move the patient a little, kung matouch niya, sa ibig, ang toes niya lang ang ato niya, footstool. Clear? Sige, the count of 3, we need you to stand. Break it down mga anay ha. Hindi pwede, madiritsuhon mo siya darao. Okay? Kasi mas nubo si chair or si wheelchair. Sige, count of 3 will stand. 1, 2, 3. Okay. And the count of 3. Sorry. Okay, para tapos. Sige, count of 3, you need to stand. Count of 3, you need to side step with your good leg down on the floor. And count of 3, you need to pivot. And sit. There. Here and okay na ni si patient. O dapat center ang chair. Secure nga siya sa back bend. Naka-rest yan. Scoot backwards. Alright, okay na tayo? Okay, are you done? Yes?
Yes.
So are we done?
Yes.
Yes. Okay. Sige, questions? Studying 5, what chair to bed? Bed chair. Okay, make sure ka. Basta balik ako mo ha. That's what we discussed. And going down also. Sige, again, this is just an example. Ito gitemo ko ni kanina, the use of your sliding board for lateral transfers. Or here, we'll do a two-person. Kasi there naman. Di volunteer ka. Sige, still the same. The leader will be usually the biggest, the strongest, and the tallest. Sige, here. So for demo purposes lang ah. So the other co-lead will hold on under the popliteal area. So meaning, mga traditional stance siya. Sige, to show us anong traditional style. Oh, this deep squat. Anong traditional kaganit? Anong traditional ka? Oh, this is the combination of not power lift. For deep squat and half kneeling. Ang dugo natin katin. Ang dugo ang Sige, for the leader, so high position, so usually, di ba, pag-cross the patient, we do not hold on to the elbows like this. Because ang tendency is, pag lift ka, what if malang alam po? O kuya, kasi patient, half of the body will fall back or forwards. Clear? We don't also use this. So, too much, kung diritanan, okay, so pwede kung ma-impinge ang radial artery along the axilla. Okay? So what we usually do is, we just go under the armpit and hold on to the wrist or just above the wrist sa forearm. Nakaabay. Okay? So usually, pwede right hand over the right forearm, left hand over the left forearm. Mayroon man iba, makita niyo naka-amnis. Okay lang if medyo small or petite si patient, maka-amnis. Or usually for bigger ones, budlay nga mag-cross ka. Okay? So same side na lang. Right hand, right forearm, right, left hand, left forearm. Clear? And then we do this. Okay. So, medyo mas budlay kay L'Oreal kay alin siya sa dalo. Okay? Pero mas magaan iya i-lift. Okay, so you count to 3, we're going to lift the patient. 1, 2, 3. 1, 2, 3, we put the patient in the and we'll move the patient to the center. 1, 2, 3. Sige, questions. When you're 2% dependent, wheelchair to bed. None? Sige, and vice versa naman. So this time, so still the same. Medyo gulay lang for the one here sa head, kasi you would need to reach makadali the patient. Okay, count to 3, we're going to lift the patient. 1, 2, 3. And lower the chair. 1, 2, 3. Sige, questions? None? Clear on that? No, that one. You discussed that natin. Isulit ka lang. Sige, question so far with your transfers. Bed and then in and out of the bed. None?
None.
Sige, special conditions lang. First is your THR. THR is total hip replacement, very common for elderly due to arthritis. So, the femoral head is replaced, usually with